to our Bonita's Maternity Program webinar. Today we're speaking with Sister Ingrid who will be chatting to us about post-birth care for moms. Welcome, Sister Ingrid.
Thank you very much. I'm really happy to be with you again today. And today's topic is really important for all pregnant moms to really think about what will happen after the birth. I find a lot of times one focuses so much on the birth itself, all the preparation for the birth, and what you can expect and what's going to happen, at the birth. And then everybody forgets really as to what happens when you go home. So that is really the important thing, to also think and plan for the being home, for especially the first month after birth. Okay, so I would actually say, first of all, this is my baby Erica. So if you come home from hospital and you've got your little baby, what now? How do you cope? How do you recover after birth? And let's face it, your body actually did some amazing things. First of all, growing this baby and then having the baby, whether it was a natural birth or whether it was a cesarean birth, your body did some amazing things. And you have to remember that you have to give yourself some time. So, you have to also recover from that. It is very different to other recoveries where normally you could just lie in bed and you can just recover from, if you had an operation, where if you have a baby, you can't just not do anything because suddenly you have a little person to take care of. Okay, so what happens then around you? What can you do to make things easier for yourself? Okay, so I would actually start to say your first month after birth is called the baby moon. So I love the term baby moon. It's like honeymoon, if you get married. This is now the baby moon where you and your baby actually, or your new family, can get to know one another, and then also where you can recover. So with the baby moon, what that also means is that you can actually then stay home. I would actually say that you don't have to do anything, if possible at all. The first couple of days after birth, once you're home, would say get onto the bed, if it's in the bed, if it's winter time, if it's on the bed in summertime, but really have your feet up and try to rest as much as possible. Let's face it, nights sometimes can be quite challenging. You might be awake often, your baby wants to feed all the time, you don't get a lot of rest. The rest of the family is sleeping, so you are the one that's going to be waking up. That is the reason why it's really important. So whenever your baby is sleeping, that you can also rest and sleep. So really the baby moon is all about resting. So you have to be either in your bedroom, to often that you can have your feet up, or perhaps you have a place in the lounge where you can have a nice couch where you can say you're really comfortable. It's really nice for napping. You have everything around yourself. You can watch something, possibly even in between, or listen to podcasts or to music or something. And then also really resting a lot. So the resting really is the important bit to really think about and to see how can you manage that. Because with us as women, as moms, there are so many things on our plates anyway. This might be your first baby, which might in some cases be easier. There are less things that really need your attention. But your house does. So sometimes even it feels that moms feel that they have to, they have to clean the house and wash the dishes and prepare the food. But really, the baby moon would mean that for the first month, that is not your responsibility. If possible at all, somebody else takes that responsibility. Perhaps your partner can, perhaps you can get someone in to help you. Perhaps if you don't have a domestic helper, it might be beneficial to say for the first month, get some help, even if it's not every day, every second day or once a week, might be a really good idea to just take that off your plate, that you can say, I can actually rest and I don't have to worry about what happens with the rest of the house. Okay, so the baby moon is the important bit. So lots of resting, lots of sleeping, lots to get to know your baby, cuddling, kissing your baby, just all in all getting to know one another, because it's also very new for your baby. Your baby it's new, this world outside the womb, so it is really important to be with your baby a lot. Okay, so that is really the first month that to really prepare that. So what can you do in pregnancy? already thinking about that first month at home, that you can really say, take it easy and try to rest as much as possible. Okay. If you even now in pregnancy, if you're preparing food and you're making something, it might be a good idea to make more and start freezing meals so that you don't have to think about it afterwards. And just bring your partner into the kitchen, really, he can also start to learn how to make something. Perhaps he's the better cook, so who knows? But it is something to really think about how you're going to do the food aspect after birth. Perhaps you've got family coming over, your mom-in-law might be there, but that is really what it's about, thinking about that first time after, or the first month after birth. Okay, now let's focus also on our own bodies, the healing of your body. What happens, okay, after birth? Now, the first thing that you might notice, obviously, is once you have your baby, that you will have vaginal bleeding, which is quite normal. Remember that the uterus was enormous. It was big. It was the whole abdominal area was filled with the uterus. And to think about it, that everything was squashed out of the way to make space for this growing baby. That uterus after birth has to basically back to the normal size of about your fist, that basically sits behind the symphysis pubis bone, which is right in front. So normally you don't even feel the you don't feel the uterus, but directly after birth, the uterus is quite big still, so it might feel like it's hard tennis ball even, and it often starts round about at the belly button. That is about the place where it starts, and if you think about it, it has to actually even get smaller to eventually be at the normal size. So that all has to do also with vaginal bleeding, where the placenta was attached at the inside of the uterus, where the placenta let go, and then obviously these are open veins, so there will be some bleeding. But with the contraction of the uterus, every time when you breastfeed your baby, the uterus contracts and that stops the bleeding. And then also what it does, it actually controls and it stops then the bleeding, and it helps to get the uterus back into the normal shape and normal size. Okay, so something there is, it's quite important to also understand that you will have some after pains. We call it after pains. Perhaps with your first baby, you don't really feel it so much. Often with the second baby, you feel it more. And then the third baby, you're convinced we actually forgot another baby. You're back in labor every time you breastfeed your baby. But don't worry too much about it. It is only for a day or two. It really is just the hormone release to really just get this uterus back into, to get it smaller again. So it really has to work hard at that. Okay, so if you feel really like a contraction when you are breastfeeding, don't stress, there's nothing wrong. Okay, this is quite a normal situation, what actually happens at that time. Okay, so now with the vaginal bleeding, I brought along a pad. Okay, so I just want to also chat to you about what can you do for healing and for, with the perineum, because the perineum is now the area that had to really stretch for the birth, where the baby actually went through. That skin actually, and that whole tissue area there, had to really stretch and basically birth the baby. And so there might be some bruising, there might be some swelling, it might just be uncomfortable. You might have stitches, or perhaps you don't have stitches, but still that needs to heal. And something that works wonders is arnica D6 tablets. That's a homeopathic remedy that you can start taking once baby's born, and that helps for the recovery of your body. And then also by using, you have to have maternity pads. So this is a regular maternity pad, but you get, the normal, this is a regular pad, but you get the maternity pads. They're normally quite, they're a little bit thicker and a little bit longer for the first day or two. And what works really well is to actually take these pads and then just by putting it in the freezer, okay, and the reason for that is it actually becomes really cold, and it's really soothing that if you have perineal discomfort, is that if you take a maternity pad and you actually put it in or on, this coldness actually really helps for the swelling and the bruising. And to take it a step up, I would even say if you can get witch hazel as well as aloe vera gel, you can actually just put some on the pad beforehand, and then you take this, you can fold it, you can put it in the freezer or in the cooler, that it actually just cools down. It's really cold, and then that aloe vera gel, for example, will be very beneficial for healing and for just soothing a sore perineum. So that will help you, that department, to actually just feel better. Okay, so that is, you know, with the perineum, the healing there. And then also, this is a breast pad. If you have not seen this before, this is something that you would need once baby is born, that you put in your bra on top of the breast, you know, on the nipple, so that any kind of leaking that happens, that it actually is absorbed in the breast pad. So that is something that you can expect, that your boobs are going to start getting bigger. They're going to start leaking a little bit more from day 3, day 4. And then it's quite, you know, it's very useful to have something like this. Now, there are some moms that even in pregnancy, at the end of pregnancy, have to start wearing these. And this is perfectly normal. Don't compare yourself with anybody else. Everybody is a unique individual. Okay, so you can't say, because I'm not leaking before birth, perhaps I'm going to have problems. And that's really not true. Okay, so it is mainly once the baby's born, and if the baby starts to feed on a frequent basis, those are the hormones released to really get to lay the foundations for good milk supply. So you want to feed frequently. Then with you get disposable breast pads, you also get the washable ones, the reusable ones. Those are also available that you can actually put on. But you can expect there might be some discomfort initially with the boobs. The nipples might be uncomfortable, and we have spoken about it before, where it's just really important to have check the latch, how to actually latch baby, how to hold baby. Those kind of things are really important. And if you really do struggle, reach out to a lactation consultant close by to just check and help you with that, okay, because it doesn't have to be painful. Okay, so that is really with the nipples and the you know, with breastfeeding. Also, something that you can expect for the first 3-4 days after birth is that you might actually suddenly start noticing that your breasts start to fill up more, they become harder. Okay, and that's also something that's quite normal. That is where the whole milk changes, where the colostrum changes into the mature milk, the volume increases, and you might have that effect. A tip here is to just feed frequently. You want to start waking your baby so that your baby actually feeds frequently to just help you to drain the breasts. Okay, again, we have spoken about breastfeeding, we have spoken about the latch and how to look at any potential problems. So perhaps go back to those kind of you know, recordings, and then just also check them out. Okay, if we think about the postpartum or the post-birth recovery, definitely it's the breast, it's the uterus that has to shrink back to the normal size with the bleeding, and then the tiredness that moms really experience. And this is really, I have to point out this again, it is really important that you try to rest as much as possible after birth. When your baby is sleeping, you also try to rest. This definitely helps, not just for resting and just feeling better, but also even your emotional, you know, your state of how you actually feel and how you cope. The more tired you are, the more difficult everything is. Okay, so definitely sleep is very, very important. Okay, then you know, your body aches, your body, the recovery of that. If you had a cesarean section, you might experience more pain. That is something to keep in mind, that you will be given pain medication. Okay, and those tablets that are given to you are perfectly fine to take. Don't leave them out. Don't not take them because you might worry about your baby with breastfeeding. Remember, these things are given for you or to you to help you recovery. With the recovery, it's perfectly fine for your baby. They won't give you medication that is harmful to your baby. Okay, so definitely take them, rather take them and feel you can cope and you can do everything that you need to do with your baby, compared to being in so much pain later on that you feel you can't even pick up your baby and just soothe your baby. It's only a short time your baby is a newborn, It's best to really be very present at the time and really tune into your baby, and then just to really experience and enjoy this time. Okay, so that really is, if one thinks about the recovery, that is really what one needs to think about, is your body. And don't look at your friend and think, she basically went out on the 3rd day after birth, she was already in Pick and Pay or wherever. Is your experience. It's your baby's birth. It is your experience after birth, and you have to listen to your body. Okay. The ideal is to really take it slow. Okay. And then once you start finding your feet, to say, okay, perhaps I can get out a little bit. You can go out into the garden. You might actually take the pram, put your baby in the pram, and just go for a little bit of a walk every day, and just feel how your body feels. If you feel you're actually doing okay, you don't have any pain, you might walk a little bit further. And at any point, if you feel now you actually overdid it a bit, just scale down a bit, and then just by taking it a little bit more easy. Okay, so really, I would say the first month is really the time to explore, or to recover, to really get to know your baby, to get breastfeeding under, to really to learn with that, and then for your body to really recover after birth. And you can do this. Okay, so this is really important. And I hope if you are at this point still pregnant and you are preparing for this birth, for this baby, take some time to really think about this first month after birth. How can you best plan for that? How can you plan that people might come and help you? Or perhaps the opposite is true. You might really wonder about all the people that want to come to visit, because let me tell you, that can also go really, that can be quite a problem in some situations where you need to rest, you need to be able to feel secure, get breastfeeding on a good path. And if you have constantly people that come to visit, it can derail things for you. So just by being very aware of that, and then also just by thinking about it in advance as to how can you best plan for this to actually have everything exactly like you want it. Okay, get your partner involved, make some plans, and then chat to the family and to the friends as to what, in your opinion, what would work for you. Okay, I hope that gave you some thoughts as to what you can do post-birth for the recovery of your body, and to just get to know yourself as a new mom, as a new parent, as well as to get breastfeeding off to a good start. Thank you very much. I can perhaps just also, while we're waiting for questions, a question that I often get is how to actually deal with family beforehand, how to actually go about that without stepping on toes, because sometimes you don't want to say something and then you're perhaps upsetting the other person. But it is a good idea in pregnancy already to really think about this. And then depending on where you live, sometimes it just helps to switch off the phone. Once baby's born, that you cannot be reached, or it's on silent, okay, that people can't just phone and just arrive, or that the gate is locked, if it's possible, they can't actually get into the property. And just perhaps by making a note there and say, mom and baby are sleeping, please leave a message or something like that, or at the door to possibly just put a note down to say, you are resting, you are sleeping. Some families find that they do beforehand, they actually tell their family and friends that they'll send out a message when they're ready to take visitors, and then once you have your baby and you actually feel like you are coping okay, is to then have a date that you can say, okay, tomorrow, let's say in the morning, it is a good idea to, 10 o'clock, people can come in and and just come and visit and just come and see the baby or whatever, something like that. But it is a good idea to have some sort of plan in place. For other people, again, they want the company, they crave the company, they wish there were more people coming in. And this is where we're all different. You have to see for you as a person, how are you? Would you like company, or is it something that is more private for you to just find your feet and to get to know your baby and to rest as much as possible?